Hi, I'm Rachel. I'm an integrative counsellor, which means I use a mixture of both person-centred and cognitive behavioural therapy to meet my clients' individual needs. Whatever my client brings with them, I'll mix those therapies together so that I'm always listening to what they need first. I'm also a member of the Counselling Directory and I'm founder of Whatever the Weather counselling practice in the West Midlands. I suspect we are all addicted to something. I know I am guilty of being addicted to my mobile phone, sometimes checking social media. For others, it can be alcohol, gambling, smoking, or even exercise. Because addiction itself is a description of a behaviour which offers us some kind of reward, which is in essence why it becomes so addictive. Having a smoking addiction, it isn't unusual, and it can be down to a variety of factors, including things like the age you were when you started smoking, perhaps your caregiver's relationship with tobacco, your genetics, and much, much more. What we do know is common with everybody who is addicted to smoking is that within a few seconds of taking a drag of a cigarette or vape mist, nicotine causes a release of something called dopamine, which in the brain gives you a really good feeling. Over time, as you can imagine, the brain begins to crave that good feeling from nicotine. And so you need to use more and more of it to get the same good feeling over and over again. I sometimes think of addiction as something that has control over you. And that's why there is a huge benefit to stopping smoking or fighting the addiction that you have. Not only does stopping smoking improve your health and your money situation, but by taking charge, I really feel like you're empowered to not only take charge of not smoking, but to take charge of other elements of your life too. And I guess that's where counselling can come alongside you and help. Counselling can help with the journey by offering ways to explore changing your behaviour and your relationship with nicotine. Together, yourself and the counsellor can explore other ways perhaps to find that good feeling that the dopamine gives your brain. Perhaps to work through techniques to control the urge to smoke. I'm thinking of things like distraction techniques when that addiction arises within you and you want a cigarette. What else can you do? What else could you do to give yourself that same good feeling, but that would be more in line with how you want to live your life? And within my practice, I always want to work with my clients as a whole person. You see, I see you as not just a person who's addicted to smoking. I see every element that you would like me to. I want to work with you to uncover, why did you first start smoking? What drives you to give it up? And by knowing this, by knowing yourself better, it can really help support you on the difficult days when you're trying to give up. Knowing what the triggers of sadness are that sometimes come alongside for all of us, this can really help us learn different ways of dealing with them better next time. So, for example, if you were feeling low or flat or sad and you would normally reach for a cigarette, knowing those feelings, knowing when they arise, we can begin to think through and explore how can we handle them differently? Where are they coming from? How can we explore them, get to the bottom of them? Can we change them? Can we look at them differently? Really deep dive into all of your different beings. Each client I work with is unique, but what remains the same is the total respect I and other counsellors have for our clients who want to have therapy. It is always an honour to accompany you on the path to becoming a new version of yourself. If you're ready to connect with a counsellor, you can find me and other qualified professionals on Counselling Directory, or you can find me at whatevertheweathercounselling.com.